100. This is the third consecutive year that Dublin has made the list. We've only been eligible for 3 years, so we're 3 for 3. We've been in existence since 2008, but you have a little ramp-up time before you're eligible for that consideration, and so we're very gratified to see that we've gotten that recognition again. I also want to say that Ohio Health has been recognized as one of the top 5 large systems in the nation by Truven as well. And the reason this is so meaningful to us is that the Truven methodology is based on data. It's purely data based. There's no telephone polling. There's no popularity contest, so to speak. It's all based on CMS, Medicare and Medicaid data that is publicly available, and they do an analysis of essentially the entire operation. So there's qualitative data, there is patient experience data, there is a wide variety of factors that go into that determination. So that means an awful lot to us to have that kind of recognition. We should all feel very good about that and about the level of care that's provided here. I want to shift gears a little bit and talk some about Dublin Methodist. And what I want to do this morning is give you a little bit of background, a little bit of what's going on here, but I want to take time for questions as well. So I don't want to take up all of the time with this background information, but I think some of the information is worth knowing about as we think about this facility. Let me back up to the system for a minute. We've handed out this what we call an Ohio Health Snapshot, and you can feel free to take a look through that. This gives you a really good overview of Ohio Health. So as I'm talking about Dublin Methodist, and if you're thinking about Ohio Health as well, this might generate some questions for you as well. We opened in January of 2008, had a very successful opening. My predecessor, Cheryl Herbert, essentially built this place. So to the extent that you see the beauty of the facility itself and the efficiency with which it works and the quiet and all of the nice features that go into it, that's all Cheryl's work. So I just came in 3 years after she built it, and we're just trying to continue what she started. So she did a fantastic job with it, and Cheryl is still with the system. Cheryl now is in a system leadership role, overseeing some of our ancillary services that go across system lines, things like laboratory, radiology, pharmacy, nutrition services. All of that stuff falls under Cheryl now, and she's got an office downtown. So I can tell you, she misses Dublin Methodist. This is her baby. She keeps a very close eye on me and on what I'm doing out here. We talk regularly. We have a great relationship, and she still comes out and sees us once in a while. But just to give you a few of the stats, these are some of the key stats that we looked at to illustrate the growth that we've seen. Back in 2008, we had 3,545 admissions to the hospital. In 2014, we had 5,604. In 2008, there were 33,635 outpatient visits. This year, 65,334. ED visits in 2008, 22,477. This year, 33,312. Surgeries in 2008, 2,123. In 2014, 5,551. And deliveries in 2008, 804. This year, 1,966. So almost 2,000 babies a year being born here at Dublin Methodist now. And we just added capacity to our maternity unit. So that number is going to be going up, and back when we built the hospital, when Cheryl built the hospital, we had a pretty good idea that with the maternity unit and the maternity experience that was being developed here, that OB was going to be a big service, and so it was really identified as the first service that would likely need to be expanded. Now that occurred quicker than we anticipated. We thought maybe we'd be 5 to 6 years in before we had to expand, and actually about 3 to 4 years in, we found that we were bumping up against our capacity limits in OB. And word has gotten around. I mean, clearly, word has gotten around that this is the place to have a baby. And so in view of that anticipated growth, the design of the hospital was such that maternity was right across from where the administrator's offices are in the main hospital on the second floor. And in order to expand the maternity unit, we had to vacate the administrative offices, move those over into the medical office building, and then expand into where administration had been. So OB is still up on the second floor. It occupies most of the area right above the main lobby area. And we have added 8 postpartum beds. We added 1 bed to the NICU, which we partner with Nationwide Children's Hospital to operate. And we've actually got the capability of adding an 8th bed to the NICU if we need to do that. So that was the first expansion that took place here at Dublin Methodist. That's open now. We have started to see new physicians coming, more folks coming to have babies here. I think what's occurring, and this is not just an OB, but I think what's occurring across the community is that, particularly for folks who live out here in Dublin, when they go to their physician, they're asking about Dublin Methodist. They're hearing about the patient experience here, and they're asking to be cared for at Dublin Methodist. So if that physician doesn't have privileges here, doesn't deliver here, or doesn't do surgery here, or whatever, those patients are saying, well, maybe I'll find a different doctor. So we're finding more and more physicians who are wanting to come on to the medical staff here at this facility. Now, this is a little bit of an unusual problem to have. You don't see this that often around the country, where we have an established medical staff, we have established physicians who have been here from day one, developed their practice here, grown with us as we've grown, and now there are new physicians who are wanting to come in to this facility, to this space, and practice. And it's creating some disruption. It's creating some bottlenecks. It's creating some issues of capacity. And the first one of those that we experienced was in OB. So we've addressed that, but the issue continues. For me, it's a good problem to have. I mean, it's great that more and more people want to come here and more physicians want to come here, but it takes constant work with our medical staff and our medical staff leadership to understand that that's what Dublin Methodist is about. We're here to grow. We have to take advantage of these opportunities, and we have to serve the community. So if people want to come here, we got to be able to serve them. And I have to tell you that our physicians have been superb to work with. Mylan Hersig is orthopedic spine surgeon with Ohio Orthopedic Center of Excellence, now Ortho One. I don't know how many of you know him, but he's pretty active in the community, so a lot of you may know Mylan. He has been just one of the best medical staff presidents I've ever worked with, and he's just been superb in this role as we've had this sort of good disruption to deal with.